With me in the guest is a doctor from General Hospital Ikorodu, and of course she happens to be a dentist as well, Dr. Olushola Basharun. Together we would brainstorm on this conversation, talk about this bad breath called halitosis. It has embarrassed a lot of people. Some people no longer feel confident in themselves just because of this word called halitosis. My name is Opayemi Adebambo. I will be your host for today on the issues while we talk about halitosis, the causes, treatment, and prevention. A very short breather would suffice, and then when I return, I bring in my guest and we get talking. Good morning, Lagos. It is the issues on IKD 106.1 FM every Monday through Friday, 11 up until 12 p.m. But every Thursday, such as this one, we talk about our health. Today, halitosis will be our point of conversation with my guest in the studio, Dr. Olushola Basharun. Good morning to you, ma.
Good morning.
It's good to have you in the studio.
Yes, thank you for inviting me.
Thank you for joining us, Dr. Olushola. Like I said during the introductory part of this conversation, I said this bad breath called halitosis is something that has caused a lot of depression to some people that have found themselves in this circle, and to some other persons as well too. They have decided not to even have a free conversation with people just because of this. But you being a doctor and a dentist, I know you will be able to properly define and explain what halitosis is. So tell us as a doctor and a dentist, how do you define or how do you explain halitosis?
Okay, thank you very much.
Yes, please.
Halitosis simply means bad breath. Okay, but it is a medical condition in which the breath has an unpleasant odor. Okay, it's quite common. It affects both males and females, and it can be very distressing for those people who have it. They usually feel embarrassed to speak in public. They are withdrawn, they are depressed, they have low self-esteem, low self-confidence, and generally the quality of their life is affected. And it's worth seeking treatment for halitosis.
So this is it okay to say it's a disease? Sort of, is it okay to say it's a disease?
Yes, it is a disease.
Because some will just believe that the reason why they have halitosis or this bad breath is maybe because they're not brushing regularly, or maybe because some will even tell you that is how it is for us in our family. So it's medically it's a disease.
Yes, it is a disease, and it's worth seeking treatment.
Okay, if you're joining the issues this morning, I think it's important for us all to learn from this. Even if we are not battling with this disease called halitosis, we can testify or agree to the fact that somewhere, somehow, we have people that are around us that might be passing through this disease called halitosis. Halitosis is a disease. It's not just a normal thing, like how some people will tell you, it's just normal. Like it's I want to ask you, doctor, sometimes in the morning, before we even start talking proper, sometimes in the morning we wake up and then we have this bad breath until we begin the day proper, and then we brush our teeth and we start eating something, and then we see that it's gone. Is this also halitosis? Because some people, almost everybody, if I'm not mistaken, has this bad breath in the morning. Right. Is that also halitosis?
Yes, it's a form of halitosis.
Okay.
But it's temporary.
Okay.
All human beings, including the dentist, when we wake up in the morning, we have this bad breath. And the reason is because over the night, when we are sleeping, the mouth is not active. So the saliva is not flowing and cleansing the mouth. So there could be a buildup of odor-causing bacteria in the mouth to sleep. So when you wake up in the morning and you speak, that's the odor comes out first. So, but it's expected that once you brush your teeth and you take your meal and drink water, that smell is supposed to stop. Okay, that's the normal thing. But if it now continues,
then something is wrong.
Something is wrong.
Okay. To be more clear now, doctor, let me ask this way, because I want to ask for the causes, the things that causes this halitosis, this bad breath. But then, has there been any case as a dentist? You will know better. Have you heard before? Have you seen someone before that will tell you that I wake up in the morning and there are no bad breaths for me? Is it possible?
I've not seen it.
It's not possible.
The person doesn't want to admit it. It's not possible. There will be a slight degree of odor.
Just to be sure, so that some persons do not feel like something is wrong with me. So is it fine to say it's a general normal thing?
Yes, when we all wake up in the morning.
Thank you very much, doctor. So now let's talk about some of the causes of this halitosis, talking about bad breath. I want to believe that there are causes to why
yes,
this happens. So one after the other, let's carefully look at the causes to halitosis.
all right. So there are various causes of halitosis.
Okay.
So I'd like to classify it in a simple way so that people listening at home can understand.
Yes, please.
So there are intraoral causes and there are extraoral causes.
Okay.
By intraoral, I mean things that cause halitosis from within the mouth itself. That's intraoral, within the mouth itself. Then the extraoral causes are those things that cause halitosis from outside of the mouth, maybe from the rest of the body, but not in the mouth. The only thing is that it's manifesting in the mouth, but it's not caused by something in the mouth. So now we move to the intraoral causes.
Okay.
The first intraoral cause, which is a common one, is poor oral hygiene.
Poor oral hygiene.
This is a situation where the mouth is not clean. Okay, the person is not brushing regularly, is not flossing, the tongue is not clean, is coated and furry. Okay, and this kind of person, they may also be food debris, accumulations here and there, sticky food, meat strands in between the teeth. So with all this in the mouth, and they will decompose gradually and definitely produce bad breath. So
that is for the intraoral.
yes, the first one is poor oral hygiene, where there's a lot of debris in the mouth because the person is not cleaning well, is not brushing, is not flossing. Okay, so that's the first one.
Yes.
Now the second intraoral cause is dry mouth.
Dry mouth.
Dry mouth. Now, the function of saliva is to cleanse the mouth and lubricate the mouth. Okay? So when the mouth is dry, this function is not achieved. The cleansing of the mouth is not achieved. So there is a buildup of oral odor-causing bacteria in the mouth. Okay, so we always encourage people to keep their mouths moist by taking frequent sips of water or chewing on things that can stimulate saliva production. So apart from this dry mouth, there are other conditions associated with dry mouth that can, cause halitosis. For example, people who fast a lot, like religious fasting, they are not eating, they are not drinking, so their mouth is kind of dry. So such people will experience bad breath. Okay, and there are some other medicines too that can cause dryness of the mouth.
Okay.
Some drugs like antibiotics, antihistamines that they use for runny nose.
Yes.
And some antihypertensive drugs like diuretics. It can also cause dry mouth, which will now lead to halitosis. Okay, so I've mentioned two now.
Yes, two. That is from the intraoral
causes.
Yes.
Poor oral hygiene, dry mouth.
Dry mouth.
Now the third intraoral cause is periodontal disease.
That's huge.
I'll break it down.
Please.
What this simply means is disease affecting the gum and the other supporting tissues of the teeth. The tooth is not just floating in the mouth. It's being held down by some tissues.
Yes.
The bone, periodontal ligament, fibers, and other connective tissue. So when there's an inflammation or a disease affecting those structures, we call it periodontal disease. So in periodontal disease, there is usually the creation of space between the tooth and the gum.
Okay.
Such that food particles can accumulate within that space. We call that space pockets, periodontal pockets. So if that pocket persists, it can cause an infection which will lead to pus accumulation, and of course there will be bad breath. Okay. So periodontal diseases too can cause halitosis. Now the fourth intraoral cause is the presence of odor-causing bacteria at the back of the tongue.
Okay. At the back of the tongue.
Back of the tongue. These organisms are there naturally. Okay. But when we now take in our diet, especially protein diet, these organisms will react with the amino acid in the protein to produce sulfur agents that have this smelly taste like hydrogen sulfide. Okay. So the presence of odor-causing bacteria at the back of the tongue can also cause bad breath. So that's the fourth intraoral cause.
Intraoral cause.
Okay, going on again with the intraoral, we still have some like ingestion of heavily spiced food You know, some people like to prepare their food with various spices like garlic, onion, ginger.
They love the spice.
Turmeric, cinnamon, bay leaves, all sorts of spices. They just use it to prepare the food. They believe it will make the food taste better or richer. And meanwhile, each of these spice has its own unique smell. So imagine when you now combine everything together and you eat, definitely you are going to have a bigger smell from the combination of all those spices. And it is until your body has fully digested and absorbed those spices before they don't smell again in your mouth. Yes, if digestion has not taken place, for example, and the person belches,
the smell still comes back.
Will come out. Yes. And in some people, they believe that chewing on these spices can improve their health. For example, some people chew garlic raw. They chew it raw because they believe is a natural antibiotic. It will kill whatever germs are in their system, and it lowers blood pressure. So they chew it regularly. And when you speak with people like that, you will perceive that garlic breath. Okay?
Yes.
So another cause is the improper use of dentures.
Okay.
Dentures are removable dental appliances that are used to replace missing teeth or a tooth that has been extracted. We use the dentures to replace them. So we dentists, we recommend that when you are going to bed at night, please don't wear your dentures to bed. Take it out. This will ensure that the gum and the supporting structures over which the denture lies, they have time to rest. They have time to breathe and get enough oxygen for another day's job. Okay? So, but when people don't take out their denture, they wear it 24/7. These structures underlying it, they become tired. They are under pressure from continuous wearing of denture all the time. They are under pressure. And this pressure can progressively lead to periodontal diseases. And then creation of pockets, and then halitosis comes in. Okay? So also, if they don't clean their dentures properly, it can also give odor. Reason being that as they eat and drink, food particles will hide beneath the denture around it. And if you leave it there continuously without taking it out to clean it properly, it will start smelling. It will give a horrible smell. So improper use and cleaning of denture, that's another intraoral cause. Then the last intraoral cause I want to talk about is the intake of tobacco. Yes, of tobacco products. For example, cigarettes, smoking, smokeless tobacco, and even snuff. Yes, these tobacco products, they contain nicotine. You know, nicotine is the active ingredient in these substances. And this nicotine has been found to cause reduction in gingival blood flow. That is the blood flow to the gingiva. This irritates the gum. It irritates the gum, and gradually it can progress to periodontal disease. Okay? And from there, the patient can develop halitosis. Because once periodontal disease sets in and there's no treatment, it progresses, and one of the symptoms is bad breath.
Bad breath.
Yes.
Dr. Olushola, you know, mentioning over 5 causes of intraoral causes alone makes me wonder that all of this in one mouth, all of this could happen in one mouth. That is very, very serious. Now, all of these that you talked about, you mentioned over 5 of them. I want to believe there are preventive measures to them. But before we talk about the preventive measures, I'd like for us to touch down the oral causes as well, too, so we could strike a balance.
Okay. So the extraoral causes, like I said, there are things that cause it from outside the mouth. It's not the mouth that is the problem.
Okay.
It's coming from somewhere in the body.
Now this is from within.
Within the
body.
Okay. So example of there are some diseases that can cause this. Okay. We call them, they are mostly called systemic diseases because they affect one or more systems in the body. So for example, in the respiratory system, there's a disease we call chronic sinusitis. What this simply means that there's repeated infection of the sinuses. Sinuses are spaces at the back of the nose. They are supposed to be air-filled. But when there's an infection, they become filled with fluid and mucus. And this can produce smell over time because the disease is recurrent as one phase is ending,
another one is coming.
So it's recurrent. So you continuously have fluid and mucus back there, and then it smells. So you can perceive it from the mouth.
From the mouth, because definitely the nose and the mouth are
connected. Yes. So that's one disease. So the second one is when you have bleeding disorders.
Bleeding disorder.
You know, there are some people that they bleed easily, even from the slightest bruise or prick.
And they start bleeding
so much that they have to go to the hospital to stop that bleeding. So those kind of people, we suspect that they have bleeding disorders. Their bleeding system lacks some basic clotting factors that could stop the bleeding. So for such people, if they accidentally bite themselves or bite their tongue or have a bruise while brushing, they may start bleeding so much in the mouth. Okay? And when they bleed, the blood clots up in the mouth. It forms thick clots in the mouth. And then when you leave it over time, it decomposes. So when clotted blood decomposes, it gives a very bad smell. Okay? So that could also lead to halitosis. If they don't clean it out from all the corners and a clot is still there decomposing, they will have bad breath.
That is the second one for the extra oral. Yes.
So there's still some more, like another disease called diabetes.
How does diabetes have to? What's the link?
Okay, there are two ways.
Okay.
In which it affects that produces halitosis.
Okay.
The first one is that in diabetes, you know, the problem is there's high sugar or glucose in the blood.
Yes.
So this high level of sugar irritates the gingiva. Okay. It irritates the gingiva and predisposes to periodontal disease. Okay. So once they start having repeated periodontal disease due to the high level of blood glucose, then they come down with periodontal disease, and from there they will have halitosis. Apart from that, people who are diabetic, they have this ketone breath. We call it ketone breath.
Okay.
The reason is because their body cannot break down glucose for energy. Okay, so their body will be breaking down fat for energy. So in the process of breaking down that fat, other byproducts are produced. Byproducts like ketone. And when that ketone is high in the blood, it's usually expelled through the lungs, and you smell it in their breath. So that's the link.
Dr. Olushola, thank you.
Yes.
Thank you very much for that.
More.
Okay, yes, please. Yes.
The last one.
Okay, which makes it the fourth one for the extra oral.
We call it psychogenic halitosis. Psychogenic halitosis. This is a condition where a person believes he has bad breath when actually he doesn't. There is no bad breath. He just imagines it, or it's a thing of the mind. He believes he has it and it's not there.
Oh, really?
Yes.
People could just sit down and think they have bad breath.
Yes.
Wow.
Yes, it happens. You know, maybe because they are very sensitive to the way people react when around them. Maybe people touch their nose or feel uncomfortable.
All those reflex, and then they think it's because of them.
They just read meaning into it that,
I have bad breath.
Maybe I have bad breath. And, you know, they start withdrawing and holding back. And from there, it puts it heavily on their mind. They'd be thinking about it morning, day and night, and be looking for solutions for something that doesn't exist. You know, it's just in their mind. We call that psychogenic halitosis. So we've seen a lot of cases.
Oh, you've seen a lot of cases of that?
Yes.
Wow. Okay, if you're just joining us, today we talk about halitosis. This is in line and in agreement with the General Hospital Ikorodu, and that is how we do it every Thursday. Today, an exposure is being made on halitosis. This is bad breath. We talk about the causes, the treatment, and of course, preventive measures to this. Doing justice to the conversation already, like you know, he's Dr. Olushola Basharon, a dentist from General Hospital Ikorodu. Now, from all of the causes that you talked about, you did well to differentiate them. The first one is the intraoral, which has about 6 kinds, and then you have the extraoral. You mentioned about 4 of them. Now, the one that I want to ask question on is the bleeding for the extraoral.
Yes.
Bleeding disorder. Now, there are cases where people brush their teeth in the morning, and then truly, just like you said, you see that there are particles of blood in it. So can that also be said to be bleeding disorder? Because this time around, they see that they split out the the blood. Is there still any form of, could that also be said to be bleeding disorder?
Not exactly.
Okay.
Reason being that, number one, the way some people brush, you'll be scared.
Honestly, some people brush like they're brushing a gin.
And they use very hard toothbrush. So there's no way you'll be scrubbing so hard that you will not traumatize your gum.
The gum.
And the bleeding will not occur. So we cannot classify that as a bleeding disorder.
Okay.
It's as a result of trauma from excessive scrubbing or brushing. Okay, so we can't classify that as a bleeding disorder.
Because I needed to be very, very sure. Some people right now will just feel like, oh, because I used to see those blood particles, then that means that's bleeding disorder.
No.
Okay. Thank you very much. You can be a part of this conversation. That is, you can send in text messages or WhatsApp messages to our studio line 0904-082-1061. That is 0904-082-1061. For questions at all on this conversation, Halitosis, the doctor will be here to do justice to your questions. But if you want to call in to speak with her directly, that's also very fine. All you need to do is call the studio lines 0904-081-1061 or 0904-082-1061 as we talk about bad breath, commonly known as halitosis. Now, doctor, coming back to you, I want to know now, when you've talked about the two causes, the two major causes, and then you did well to split them, how about, I was doing some little findings and I saw the word psychologic and then another one pathologic or thereabout. Where does that fall to and what do they really mean?
Okay. The first one, psychologic.
Psychologic, yes.
That has to do with the psychogenic halitosis.
The one you mentioned?
Yes.
Oh, okay.
It's a thing of the mind. It's imagined. It's not actually there. Okay, that's the psychogenic. Now, the pathologic you mentioned is the one that has to do with there's a disease or something causing it, like all the intraoral causes that I mentioned.
Okay.
And all the systemic diseases like diabetes, bleeding disorder. There is something causing it. The halitosis is actually there. Okay, do you understand?
So there is something actually pushing it out. There is a
cause.
There is a cause.
Yes, there is a pathologic cause, a disease state that is causing the bad breath.
Now I get it. So, doctor, before we talk about how to prevent this, because we just have to prevent it.
Yes.
Since it's a disease, it should be prevented. But before we talk about the preventive measures, let's talk about some of the symptoms. Okay. The reason I want us to talk about symptoms and the reason I'm asking this question is because, funny enough, some people don't even know they have bad breath.
Oh, yes.
There are some people you will tell that you have bad breath and they don't want to agree because they don't even know. So what are the symptoms for people out there listening that they should be on the lookout and say, oh, if I'm seeing this, if I'm perceiving this, if I'm feeling this way, these are symptoms to the disease called halitosis. So let's talk about the symptoms.
Okay. The symptom basically is when you perceive the odor. That's the first thing. And usually, some people perceive it by themselves. Some people don't. It's other people close to them that usually tells them that, you have this bad breath. Especially spouses. Maybe the husband can tell the wife or the wife can tell the husband. So that's the first sign. The bad breath is there. Either you perceive it yourself or other people will tell you as you interact with them. So then the second symptom you may notice is withdrawal. The person may be withdrawn from people, doesn't want to talk, doesn't want to interact. He keeps holding back.
There's this form of inferiority
complex. You notice it in their behavior. They are anxious sometimes. They are nervous. They can't stay still. When people are moving or doing like this, they too, they are restless because they feel that, hey, maybe the
am I the cause for this? Yes.
So they are nervous, anxious. Okay, so those are some of the symptoms.
But majorly the smell.
The smell is the first thing.
Majorly the smell.
Yes.
So when the smell starts coming, then you should know that perhaps this is halitosis. So let's talk about stages. Are there stages at all? Because when you say halitosis is a disease, right? Definitely for most diseases that we know, that common diseases, we know that there are stages from this stage to this stage.
Yes.
Is halitosis also in that circle of stages, or it is just something that when you have it, you have it? It's not going to deteriorate to another stage or something?
Well, there's to a certain extent, it has staging.
Okay.
For example, we talked about when we wake up in the morning,
yes,
all human beings, that we have this bad breath. Okay, and I said that once we do our proper oral hygiene by brushing and we take water and eat, that odor is expected to stop. Okay, so that can go for the first stage.
Okay.
It's expected to stop. That's stage 1.
That's
now,
after brushing.
After brushing. Now, if it persists, even after brushing, and people are telling you and you are perceiving it yourself, then that means it has progressed to another stage.
Another stage.
And that stage, you need to seek help from the dentist.
Yes, we'll get to that part because one of the things we do on the issues is that we ensure that we don't just talk about these diseases. We don't talk about all of these medical problems without profound solutions to them. And one of the solutions is to direct people in such a circle to the general hospital here in Ikorodu, and in this case, as it may be, to the dentist. So we'll get there. We want to know how things are being done at your end here, where you accommodate people, the times at which you do that. But before then, just like you have said that the first stage is maybe waking up in the morning, and then maybe after that, has there been any case where we hear that halitosis, like other diseases, would maybe take life or bring about a drastic damage to the body system, or it is just something that, right now some people just feel like, okay, is it not just mouth odor? We'll live by it. In fact, they already know me with my mouth odor, so let me just live by it. Are there dangers in line with halitosis?
Yes.
Okay.
There are dangers.
Please tell us.
Okay, I said earlier that it can be very distressing for people who have it. They are withdrawn, they are depressed, low self-esteem, low confidence, and gradually, if care is not taken, they can progress into mental health, mental illness, whereby they are constantly depressed and they have suicidal thoughts. Yes, that this halitosis wants to kill them. They had better go and kill themselves first before it kills them.
The thing kills them.
So some have suicidal tendencies. That means it has now shifted to another level. It's not ordinary halitosis again. It's now affecting them mentally. So, and if care is not taken, those who are having suicidal tendencies, they can actually do it and end their life.
Especially those that can't control their minds.
Yes. Some people are strong-willed. They can face challenges.
Yes.
But some people, they just break down and allow the situation to overcome them.
0904-082-1061 0904-082-1061 is the studio line. Send in text messages or WhatsApp messages preferably, and then of course we'll take them right from our studio here, and the doctor will be here to do justice to your questions whatsoever. If you want to call in as well, feel free to call our studio lines 0904-081-1061 0904-081-1061 or 0904-082-1061. Doctor, one of the ways at which some people would think, in their minds that it's a way for me to just cure this bad odor thing is to chew gum. And we have heard people on several occasions say that when I chew gum, the thing will just go and the smell will be hidden. But let's take this call first, and I come back to that question. Hello to you. Hello. Okay, you can call us back on 0904-081-1061 or 0904-082-1061. Doctor, chewing of gum, is this a good way to cure or prevent halitosis? We are gradually stepping into the preventive measures. But I want to know first, chewing of gum, is it okay? The reason is because some will tell you it's good. And at the same time, we have heard on several occasions where they will tell you, if you chew gum too much, it affects your gum, it affects your jaw, and then they become weak. And we are hearing a lot. Yes. So please tell us professionally, medically.
So chewing gum is actually recommended by the dentist. Okay?
Oh, really?
Yes. There are some brands of chewing gum that we recommend because they are sugar-free. They don't contain sugar because sugar can damage your teeth, causing tooth decay. But the brand of chewing gum that we recommend is sugar-free.
Sugar-free.
The reason why we recommend chewing gum is that it stimulates saliva production in the mouth. When you chew gum, you will notice that it produces more and more saliva in your mouth, and you keep swallowing the saliva. So when there's increased salivary flow in the mouth becomes self-cleansing. Okay, so and it makes the mouth clean, and you won't have that bad odor. It masks it sort of, and then with that chewing process, the mouth is lubricated, the mouth is active, and there's further production of saliva that washes away all the odor.
So it helps activities going on with the mouth.
Yes.
Yeah, now again, still on that question, please pardon me. Some will still tell you that when you're even chewing the gum, as soon as the sweetness is out already, or as soon as you don't feel the vibes anymore, you do away with it. So how best is it medically as a dentist? How long are we supposed to chew gum to help our mouth activities?
Once you chew it,
yes,
and the flavor is gone, you know, most of these chewing gum, they have flavors like mint.
Yes.
Once you chew it and there's no flavor again, and the chewing gum becomes too hard in your mouth, it's time to
and it start breaking.
Yes, it's time to do away with it. Okay. At that point, you can just refresh your mouth by taking frequent sips of water or rinsing out. Okay, to give your mouth a break from the chewing.
Okay, Doctor, we want to thank you so very much. Still on this conversation, halitosis on the issues today. Doctor, now I want to ask, how can we prevent it?
Okay.
First, then after then, we then talk about how it can be cured. Because as we speak, some persons out there are already having this disease called halitosis. So before we can talk of how to cure this disease, how can we even prevent it from happening?
Okay. So, prevention, they say, is better than
Thank
cure.
you.
So there are many ways by which you can prevent halitosis. The first one is by maintaining good oral hygiene. Okay, it's very, very important. You know, the mouth is the gateway to the body. Everything you eat and drink goes in through your mouth. So you have to keep it clean. Okay, you need to take the time to keep your oral hygiene in good shape. So that's why we recommend that you brush twice daily.
Twice daily.
Morning and last thing at night.
At night.
And you use a good toothpaste that contains fluoride. And then your toothbrush shouldn't be the hard texture. You use a medium textured brush. And for children, they use soft textured brush. Okay, because if you use hard, you're damaging your gums and you're adding to the halitosis from the bleeding that will occur when you traumatize your gum. So
good oral hygiene. Yeah, but when you say good oral hygiene, and then you talk about don't use hard brush, some will tell you, is there anything like I have a hard teeth? I know there are people who say my skin is hard, my hair is hard. Some will still tell you I have a hard teeth, that's why I'm using a hard brush to battle. There is nothing like hard teeth. But people who say they have hard teeth.
No, nothing like that.
So good oral hygiene is the first thing to do to prevent. Before we go to the next one, maybe we should attend to this message. This is coming from WhatsApp from Sholaja Oluwase SOS. Good morning. I want us to know that the foundation of the mouth odor is you. Don't use your mouth for long time and the feeds inside the stomach has not digested. I'm Sholaja Oluwase SOS from Igbobo Stadium Road. What this person is saying is the foundation to mouth odor is the use of the mouth for long. And this person is saying don't use your mouth for too long. And Doctor, what do you say to this?
No, that's not correct.
Please let's enlighten this person.
Because when you don't use your mouth, the salivary production is reduced. And the mouth will not be self-cleansing. Okay, so you are adding to the problem. You are encouraged to speak, interact, use your mouth, chew, so that saliva production will increase and the flow will cleanse your mouth. So to I don't know if this person is a male or a female, but Sholaja Oluwase SOS from Igbobo Stadium Road, please, we need you to correct that notion. It's okay for you to use your mouth. It's okay. It's different when you say the person is a talkative. That's not what we're saying. But it's okay for you to use your mouth. There is nothing wrong with that. And of course, it's also okay for you to feed well. Because here you're also talking about maybe feeding too much. The foods that goes into the stomach are not being digested. That is actually a different... Well, maybe she's talking about the spices I mentioned.
Or maybe yes, just maybe
yes. And I said that until those spices have been digested and fully absorbed in the body before they...
I think that's what this person is talking about. Okay, the person is typing, so let's hope that there will be a correction from there. So good oral hygiene, that is one of the preventive measures to avoiding bad breath. Aside food oral hygiene, aside you called it proper hygiene.
Maintaining proper
hygiene. Aside that, Oral hygiene, aside maintaining proper oral hygiene,
Yes.
what should be the next thing to prevent
Yes.
bad breath?
People should avoid home remedies and self-medication.
Home
No,
remedies.
Yes. When you discover that you have any issue with your mouth,
Mm.
your tooth, or you have halitosis, you shouldn't try to treat it at home by yourself.
Mm.
It's better you seek dental help from the professionals so that they can give you accurate treatment. Don't do self-medication at home. We have heard of people using all sorts of things to clean their teeth, their tongue, just because they want it to appear whiter or they want it to smell better. So avoid self-medication. Avoid home remedies. Thirdly, visit your dentist for a dental checkup at least twice a year. That's every 6 months.
At least twice a year.
Yes. So when you come for checkup, we'll take a look at your mouth. We'll look for any issues that may be there, and we'll correct it at that visit so that it doesn't progress into something else. So dental checkup.
Dental checkup. Doctor, when we say bad breath, popularly called halitosis, is it contagious? Is it hereditary?
No.
You know, because I'm looking at maybe married couples, then the man has it, the woman does not. But for the fact that they are both married, the constant relationship, is there going to be a spread from the man to the woman, or from the young man to the young girl, as the case may be?
It's not contagious.
It is not contagious, and it is not hereditary.
If you have it on your own.
It's for you, yourself alone. Okay, we're still taking in calls and text messages or WhatsApp messages on our studio line 0904 081 1061. Hello to you. Good morning.
Hello, good morning.
Yes,
My
good
name
morning.
is Friday.
Your name is what?
Friday.
Friday. Calling from where?
Ikorodu.
Thank you very much, Friday. Talk to us.
I have two questions.
Go ahead.
And I greet the woman over there as well.
Good morning.
The first one is, can the mouth odor, can it be a thing that it should never go away despite any giving it solution? As in, can it be hereditary? What I mean is, can it be a thing that it will...
It becomes permanent.
Exactly. No matter what you do to it, it will not go. And the second one is, she said something about brushing just now, that when you brush, maybe you should not use hard brush. Probably maybe if the blood is coming out. So me, I want to ask, is it when you brush and it brings out blood, is it not a sign that you brush it very well that makes the blood to be coming out? Maybe it's all those things that hide under the teeth.
That the ones that come out in form of blood.
Exactly. Or is it that you wound yourself, that as in that maybe that is the...
Okay.
Maybe that one is also a problem, that when you brush and the blood come out from your mouth, is it a problem, or is it a sign that you brush very well?
Thank you, Friday. Thank you. Dr. Olushola will attend to your question. Thank you. So let's attend to his question.
Okay, the first one, he wants to know whether halitosis can be completely eradicated.
Oh no, he wants to know if halitosis could become a permanent thing, that when you have it, it will never go again. It becomes a part and parcel of you.
No, I don't agree with that.
Okay.
Because in the treatment for halitosis, once you identify the cause, then the solution is easy to get. Once
Great.
you know what is causing it, then there's no problem again.
Great.
So all you have to do is address the issue causing the halitosis, and the halitosis will stop. So that's it.
Okay, so the second question.
Except it's the psychogenic type, where the patient now has to go for further counseling with the
to convince
mental
him or
health
her
specialist to counsel the person that you actually don't have
it. Then I think the second question he asked, when brushing and then you see blood, is that not a good sign that I've done well?
No, it's not a good sign. No, it's not a good sign. It is a sign that you are traumatizing your gum. You are causing injury to your gum. So when you see blood after scrubbing, it doesn't mean that you have done a good job.
A lot of persons used to believe, especially at the young age, we used to believe that brush until you get to that level and then
no, that's not right. No.
And some people would also want to believe that if I brush well, I will have white teeth. Some feel brown teeth, I want to make it white, so I need to brush so hard. I know. But doctor, I should ask you, do we have types of teeth Do we have the brown, the white? Because some people, no matter how they brush, we are not seeing the white teeth.
Yes, some people, we have a natural color for our teeth.
Oh, okay.
All individuals, they all have their own natural color. Some people, when you see their natural teeth, they haven't bleached it, but it appears so white.
So white.
And some other people, their teeth appear creamy colored. And it's not as if they are not brushing. It's just their own natural color that God has given them. Okay, so we call it shades. There are different tooth shades. Some are very white, some are colored. Okay, and apart from that, there are other conditions that can cause discoloration of the teeth. Right, maybe by staining. We call it intrinsic stains and extrinsic stains. Intrinsic stains are stains from within the teeth, and no matter how you brush it, they won't go off.
They won't go off.
And while extrinsic stains are stains that are outside of the tooth. So once you do your scaling and polishing, or you do your brushing, the stains will go off and the natural color of the teeth will appear.
Will come out. Okay, so this person from WhatsApp has sent another message in person of Sholaja Oluwa Sheyi SOS from Igbobo Stadium Road. He said, I mean, when the mouth is too closed, not used to talk.
We are saying the same thing.
Yes, we are on the same page actually.
Yes.
Then he went on further to say, choose something, etc. and the last food you eat has not digested. That's what I thought. Okay, but we are still on the same page. Thank you, Sholaja Oluwaseyi, for sending a corrected message over there. Now, doctor, you talked about the preventive measures in order to prevent this bad breath called halitosis. But then let's now talk about those that already have it. Because we can't deny the fact that there are some people who have it right now.
Definitely.
And you have said it that it is curable. Then how is it curable? What are they supposed to do? Those that are actually battling with this disease called halitosis.
Okay, so those who already have it, they need to come to the dental clinic. We need to take a close look into their mouths, take a detailed history, their medical history, their family history, social history. We want to know how they eat, how they interact. We want to know if they have habits like smoking, drinking. We want to know if they have any health issue they are dealing with, underlying disease like diabetes, kidney disease, bleeding, and all that. Okay, so when they come, we do a thorough history taking. We do a thorough mouth examination so that we are able to pinpoint where
exactly
this
the cause
halitosis is coming from. And like I said, once you are able to pinpoint the cause, then the treatment becomes easy. You just go after that cause, and
that's it. So the curing process, how does it look like? You know, some persons will just start getting scared. They will choke something in my mouth, and they will just say, it's better I just stay at home. Hope it's not a rigorous process in curing this halitosis. And how long does it take to cure halitosis? Some diseases will take 6 months, 5 months. They just tell you, keep going on medications. How long does it take? And what's the process like? Hope it's not a rigorous one.
Well, it's not a rigorous process actually, but it's not something that may go immediately.
Oh, okay. It's not
It actually
instant.
depends on the cause.
Oh, okay.
Okay, so like I said, if it's poor oral hygiene, if once the person is able to maintain good oral hygiene every day, then the halitosis should stop. But if it is a condition associated with a systemic disease, for example, like in diabetes or bleeding disorder, until those diseases are under control before the halitosis will stop. So for somebody that is diabetic and you are not taking treatment for your diabetes, it's getting worse every day, the halitosis will still be there. So there is no certain period for curing halitosis. It doesn't have a duration that by 2 months your halitosis will stop. No, there's no definite duration. It only depends on what is causing it and how you manage what is causing it. If you treat the diabetes on time and put it under control, then the halitosis will stop. If it's poor oral hygiene and you
that's a gradual process.
Yes, so exactly, it's a gradual process. It's not by magic. Halitosis
Let me just go and see the dentist, and then by the time I'm coming back home, it's gone.
No, it depends on what is causing it and how you address that thing. Okay?
Thank you very much, Dr. Olushola. Before we let you go, just one more, I guess, but I'll need to rephrase this one. This is coming from Kehinde, and this is in Yoruba. Okay, this person is asking Kehinde that. Okay, the summary of this is, why is this always common amongst the elderly people, the old people? I think this person is saying in Yoruba that why is it the elderly people that always have halitosis? Is that also true to say that?
Yes.
Oh, really?
It's true. It has been observed that halitosis is common in adults, usually from 40 years and above.
Oh.
Okay. And the reason being that, as we grow older, our periodontal tissues, like I said, the supporting structures of the teeth, they also age.
Okay.
So they become loose. They are not as tight as they were when they were much younger. So there's creation of pockets, spaces around the teeth where things can hide and decompose to give bad breath.
The bad breath.
So aging has an effect also on the oral tissues. Aging. So that's why it's common in elderly people. Apart from that, most of the elderly people have one disease they are managing or the other. Maybe hypertension, diabetes, things like that. So from there, halitosis will set in. Okay? So that's why it's common in the elderly people. Most young people don't have diabetes, hypertension. Instead, what they have is tooth decay from eating too many sweet things.
Too many sugary things.
So that's why it's common.
So this is also to say that as an adult, you should be expecting halitosis.
No, you shouldn't.
Okay.
Because you do the right thing.
Now, when you say that the weakness comes from the aging, then all of the gums are weak already and all that. So there are spaces that will definitely store in all of these things. So, but it should not be something they should always expect.
No, you shouldn't expect it.
Okay. Hello to you. Good morning.
Sorry, I forgot to ask the other question.
Okay, go ahead.
Yeah.
We can barely hear you. Hello.
Okay. Yeah, now.
Maybe you should call us back if you can.
I can't hear you.
All right, please call us back if you can. We can barely hear you. So, thank you for clearing the air on that. So we would not just believe that doctors have said when we are old now we should.
No, you have to keep up the game.
Yeah.
Make sure you do the right
Keep
thing.
maintaining the oral hygiene. Okay, hello.
Hello, this is Dave Friday.
Okay, Friday, talk to us.
Yeah, I've asked this before. The woman did not to try with the question and the answer then. I said, someone asked on teeth. Can the person make it white? As in, there's something that they will do to it that you will make it to be white.
If someone has brown teeth, if I get you correctly, is there something they can do to it to make it white?
Yeah,
Okay.
Is there something that they can do? And lastly,
okay.
I want to ask: Is it compulsory that you brush your mouth twice a day? Can't you be just rinsing the mouth with water every night? Maybe when you eat, you just drink water and use the water to rinse your mouth.
Okay.
No.
Okay, Friday. Okay, thank you, Friday. Thank you, Friday. Okay, so because of time, he asked two questions. The first one, are there ways at which we could just make a brown teeth become white as a dentist?
Yes,
is it possible?
There are many treatment options for that.
Oh, nice.
Yes, so once the patient comes, we assess the degree of discoloration. If it's something that can be bleached off,
okay,
we bleach it by a process we call teeth whitening.
Teeth whitening.
Yes. But if it's not something that can be bleached off, then we do what we call masking.
Okay.
We mask the appearance by using appliances such as veneers, crowns, So.
And the person will still be able to brush that teeth with the masking.
Yes.
And the brushing of teeth won't pull it off.
It won't pull it off.
Oh, wow.
Yes, it's an appliance that is fitted onto the tooth and it stays there permanently.
Wow.
Except we, the dentist, remove it.
Wow. Okay, so the second question he asked is it necessary? Maybe because most times he gets home and he's tired.
He's tired. Yeah.
Brushing could be a lot of work, it could be. So is it necessary? Why can't we just use water to just rinse our mouth?
Water alone will not do a good job.
Okay.
We Nigerians or Africans in general, we like eating a lot of meat. So, and when you eat meat, they get stuck between your teeth. So rinsing out with water alone is not enough to remove those meat particles. So you need to brush and floss as well. Yes.
But those that feel like they have this halitosis,
Yes.
what's the process like? What do they need to do to get to you?
Okay, it's a very simple process.
Okay.
Okay, once you come to the General Hospital Ikorodu, you come to the dental clinic,
Okay.
which is on the first floor of the main building. So once you get to the dental clinic, you obtain a card, a registration card,
Okay.
and then we check your vital signs, and then you see a dentist.
Mm.
Once you see the dentist, you make your complaint. The dentist will examine you and tell you what they find in your mouth and what you are supposed to do. So, and once you are ready to do the treatment, then we do it for you.
Dr. Olushola Basharan, thank you so very much. For those of you listening, please, whenever you find the time to get to General, just go to ask of Dr. Olushola.
Yes, I'll be happy to help.
Exactly. Hold her. And she asks you from where. Tell her you heard her voice on radio IKD 106.1 FM. Want to say thank you so very much. And of course, special thanks to the management and staff of General Hospital Ikorodu. This is how far we can have it. What will be your parting words to everyone listening out there? Your medical advice as a dentist to every listener out there.
Okay, please, listeners at home, don't be afraid of your dentist. We are not here to cause any pain. We want to relieve you from your dental pain and other problems. So please feel free, come in to see us for your routine dental checkups and, of course, your scaling and polishing. We are here for you.
Thank you so very much, Doctor. It's been a nice time. This is how far we can have it today on the issues where we talked about halitosis, bad breath, which has caused a lot of harm than good. And like they say, health is wealth. Take your time today and ensure that you are living a healthy life, especially a proper oral hygiene is very, very important. My name is Opayemi Adebambo. The issues continues tomorrow, but don't forget, every Thursday we do this with General Hospital, where we help you to maintain a good health. God bless Nigeria. God bless Lagos. God bless Ikorodu. It's a bye for now.